policy that asymptomatic close contacts of confirmed cases who are HSE staff can return to work on the front line if they are closely monitored. The INMO says no way, that simply doesn't work and it's not rigorous or safe enough.
The derogation policy, we believe, requires robust backup, and that simply isn't in the health service at the moment. So if I'm a close contact, I test negative and I return to work, the evidence is that infection rates can increase. Our members tell us that the monitoring is a text message or a phone call. We don't believe that's sufficient. We believe that testing and tracing of healthcare workers in the acute hospital system particularly has never been appropriate.
Among their calls then this evening, the INMO looking for all private hospitals to be nationalised, requisitioning all of their beds. They're calling for better PPE. They're concerned that that is driving infections in healthcare workers. You have the student nurses situation, the INMO describing the lack or low pay for them as a national scandal. Frontline workers themselves say they're being pushed to breaking point.
The situation now feels a lot worse than it had when it first initially started back in March. It's extremely palpable how stressful nurses are on the floor. It's day shifts, night shifts. The level of short staffing is horrendous, and staff are really feeling the brunt of that at the moment. Members want to be in work, but with the difficulties that they're encountering, it's very, very difficult between childcare, between them becoming unwell themselves, with them coming in close contact.
By way of illustrating the pressures in the public health system at the moment in terms of ICU, 14 ICUs with no available capacity, the rest of them with between 1 and 3 beds available. In Dublin last night, just 5 public ICU beds available, 3 in Limerick, 2 in Galway, 2 in Waterford and none at all in Cork, Colette.
Richard, thank you for that. Well, health professionals are voicing concerns about vaccine priority lists and what's being seen as a so-called competition to get the jab as early as possible. Zara King has more on this. And Zara, this follows the circulation of a letter from the HSE on this issue.
Yes, Colette, so this speaks to, I suppose, the demand for the vaccine. A lot of people keen to get their vaccine as quickly as possible, and the HSE feeling that they needed to send this email out to nursing homes. This was sent to nursing homes in Cork. Let's just take a look at the contents of that email. It says it has come to the attention of the vaccination team in CH04, that's Cork, that family members have been included for vaccination in a number of care facilities. This should not occur. It goes on to say, as you are aware, vaccine supply is limited. The only priority group in phase 1 of the vaccine programme are residents within your care facility and the healthcare staff. So again, as I say, speaking to the fact that there is a huge demand for this vaccine and perhaps people being added to the list who don't meet the criteria in terms of being top of that priority list. Now, this afternoon we heard from Dr. Ciarán O'Farrill. He's a GP based in Donegal, and he was speaking about this. He said this is a big concern for the vaccination programme going forward. He said, as a GP, I'm getting calls from patients asking to ensure they are top of the list. He says the scrap among some healthcare workers to move up the priority list shows how carefully this must be rolled out. Now, also speaking this afternoon, Dr. O'Farrill talking about the situation in his own practice, telling us, Colette, that while there are less people coming forward for COVID tests this week, he says those that are COVID positive are becoming sicker.
In my own practice, we've seen a significant reduction in the number of COVID positive patients, which is great to see. But unfortunately, we've also seen an increase in hospitalisations amongst our cohort of patients who are COVID positive already, and that's concerning. We've also seen quite a lot of elderly and more vulnerable patients being diagnosed with COVID in the last week, and again, that's a concern for us now going forward.
Well, Colette, we are standing by here at the Department of Health for the latest COVID-19 figures. We'll bring them to you as soon as we get them.
Zara, thank you for that. Leaving Cert students are starting a new push for an early call on scrapping a traditional Leaving Cert this summer and replacing it with calculated grades. It comes as talks continue about how the country's schools might be reopened when the current shutdown draws to an end. Well, Paul Quinn is at the Department of Education for us this evening. And Paul, this year's Leaving Cert's mobilising effectively to be treated the same way as the class of 2020.
Yes, Colette, thousands of Leaving Cert students taken to social media today calling on the Education Minister to cancel the Leaving Cert. Of course, Norma Foley says she's determined that traditional exams will go ahead in June, but students we've been speaking to say that they've already missed too much time between last year, this year, the uncertainty of when the schools will reopen. They'd like to see predicted grades back on the table and perhaps the option of sitting exams at a later date. Now, the advisory group set up to look at this year's exams meets this Friday. However, it's unlikely we'll get a decision that soon. The unions, of course, they're continuing their negotiations around the reopening of schools. But we have been speaking to some students today to see what they'd like to see happen with this year's Leaving Cert.
We are requesting clarification, reassurance and communication right now, as soon as possible, about our Leaving Certificate. We have missed nearly up to 4 months of school, missing 3 months last year and now missing further another month. We need to know what's happening.
What we really need is predicted grades and the choice to sit a fair and inclusive exam that fully acknowledges all the time we've missed. We're asking for clarity from the government, and we're tired of asking.
We have already missed more classroom-based learning than last year's sixth-year students. This leaves us with a huge, unprecedented challenge. These predictions will allow us to have a structured plan and clarity in the months ahead.
We should not be made sit the Leaving Cert. It's absolutely ridiculous to think that we would be able to take a traditional Leaving Cert after all the dysfunctions that has happened in our year.
Now, just some developments this evening, Colette, in relation to the possible reopening of special schools and special classes. Forsa, which represents special needs assistance, says it will direct its members to go back to schools on a phased basis, provide a number of measures are put in place. They want NEFA to sign off on any plan. They'd like to see school staff prioritise for the vaccine and also serial testing take place. Now, the groups which met with the ministers earlier this week, representing some 18,000 children and young adults with special needs, said this is a significant step, but there are more hurdles to clear, and it's now up to the government to redouble its efforts to make this happen and make it happen soon.
All right, Paul, thank you for that. Well, experts have warned that tighter COVID restrictions for people arriving into the country will further hamper the travel and aviation industry. From Saturday, anyone coming here will have to provide evidence of a negative COVID test taken in the 3 days prior to travel. Aisling Kushtila has the details.
These new restrictions will kick in from Saturday next. All passengers arriving in Ireland must have a negative or not detected COVID-19 test carried out. That test must have been carried out in the 72 hours prior to arriving here in the country. Now, that restriction is already in place for a number of days for people coming in from the United Kingdom or from South Africa. And once you arrive in the country, there are differing level of restrictions depending on where you travelled from. So if you've come in from the UK or South Africa, you have to continue to self-isolate for a period of 14 days. If you're travelling in from a grey or a red country, you have to restrict your movements for 14 days. And if you're coming from a green or an orange country, you just have to adhere to the public health guidelines. But all passengers, no matter where you're travelling from, now have to have that negative COVID test. Airports around the country are extremely quiet at the moment. As you can understand, there's approximately 8,000 people passing through Dublin Airport here on a daily basis. Those working in the travel industry say that these new restrictions will likely cause a further dip in those numbers.
It'll have the effect of killing off any forward bookings and reducing aviation to a trickle over the next 2 or 3 months. It means that it makes it quite expensive to get into the country and possibly to get out again. We have very expensive PCR tests in Ireland. They cost much more than other countries. Incoming mightn't be that expensive, but it certainly, if you're travelling as a group, will raise the cost of that travel.
Well, those COVID tests will be checked at the airport by border management and members of An Garda Síochána, and there is a number of exceptions. They include international transport workers, members of An Garda Síochána who are travelling for work, and children under the age of 6.
Aisling Kushtila reporting there. Now, in other news this evening, the Taoiseach has said sorry to residents of mother and baby homes for what he called the shame and stigma they were subjected to. Speaking in the Dáil the day after the publication of a harrowing report on the homes, Micheál Martin told the women and their children they were blameless and had done nothing wrong, and the state had failed in its duty of care. Well, our political correspondent Gavin Riley joins us now. And Gavin, even this state apology itself has become controversial.
That's right, Colette. It is, as you say, 24 hours since this report was published, but 24 hours hasn't made the report any easier to read, nor would another day, nor another week, nor another month, nor another year. And although there are significant concerns and complaints around the Commission and how it went about its work, nonetheless today, as the Dáil resumed after its winter break, it fell to the Taoiseach to stand on behalf of the nation and say sorry. Yesterday's report on mother and baby homes underlined how the Ireland of the 20th century was often a cold and callous place. Today, the leaders of Ireland of the 21st century stopped to say how wrong that was.
So on behalf of the Government, the State and its citizens, I apologise for the profound generational wrong visited upon Irish mothers and their children who ended up in a mother and baby home or a county home. As the Commission says plainly, they should not have been there. Former residents talk of a feeling of shame for the situation they found themselves in. The shame was not theirs, it was ours.
The state apology was heard in person by precious few. 3/4 of TDs told to abide by public health advice and stay home. Today's notions of home a further clash with the orthodoxy of the past.
I think this report shames Irish society entire. Women pregnant outside of marriage, some very young, some victims of rape, were not supported by their families, community, or the father of the child. They turned to the church and state for refuge, and while they got refuge, it was a cold and often cruel one.
We are affirming clearly and in the strongest possible terms that they were wronged and that they wronged nobody.
Opposition parties echoed the sympathies and regret, but also took time to question the government's presentation of the findings.
This was done by the powerful to those who were vulnerable. So any idea that we did this to ourselves is deeply insulting to victims and survivors, and it is, frankly, a cop-out.
We must ensure survivors are given redress, that justice is vigorously pursued, and that people and organisations who committed these crimes are pursued and prosecuted. Shame on us if we settle for anything less.
The ethos and the social mores that the report takes as a natural given, as some sort of fixed entity, was hard worked for, was planned for, was argued for by Fianna Fáil, Fine Gael and even Labour at times, who were not innocent bystanders but enthusiastic enforcers of these mores.
Others said the state apology was premature. Some survivors haven't had time to read the report to know what's being apologised for.
I actually would have preferred if you consulted with all the survival groups, the families and the victims, regarding when this apology would take place and what would be the content of it.
But apologies offered, the focus is now on justice. And the whole process of delivering that justice will be complicated too. For example, when it comes to redress, the report finds that women admitted to some homes after 1973 shouldn't be entitled to redress because there was state supports available to them at the time, even though the report also says very few of them were aware of it. And in terms of adopted children being able to find their birth parents, the government is promising that legislation will be passed before the end of the year. But simultaneously, the Attorney-General says a referendum is needed, and the government's legislative programme published today doesn't include that legislation at all. The Taoiseach says the apology is supposed to be a catalyst for some sort of justice. We'll have to see how quickly the wheels can turn for the survivors of mother and baby homes.
Gavin, thank you for that. Well, survivors of one mother and baby home have said an apology from the religious order who ran the facility is more important than the state saying sorry. Today, the Bon Secours said the order didn't live up to its Christianity towards the women and children in its care.
The Sisters of the Bon Secours has offered profound apologies, saying many women and children were rejected, silenced, excluded and subjected to hardship, their inherent human dignity disrespected in life and death. The religious order ran the mother and baby home in Tuam from 1925 to 1961. For these men who were born at the home, this acknowledgement of wrongdoing is more important than any state apology.
It lifted my heart. Did. But sure, how many years, even before Captain Calder's or even before our time, how many years was this apology coming?
I know it took a long time to come, but I do respect and I am happy with that. And at least now that my mother respected, that she didn't do anything wrong, and that's what I was looking for.
PJ feels the 3,000-page report from the Commission of Inquiry attempts to absolve Church and State.
To me, that's totally wrong, because the priest came down to my mother's house and he laid down the law, and he was the one that told the parents to bring her into Tuam here. She came in here and she suffered all her life.
Well, test excavations carried out in 2016 uncovered significant quantities of remains of babies and young children at this site. The Sisters of the Bon Secours have acknowledged that children who died at the mother and baby home in Tuam were buried in a disrespectful and unacceptable way. Historian Catherine Corliss brought the burials at Tuam Mother and Baby Home to light.
I am thankful to the Bon Secours sisters for being honest, and it's a totally honest apology with nothing withheld. And they apologise for the way they treated the women and the children, and they also took the onus that the way they buried the children was not decent.
The Bon Secours say they intend to contribute to any redress scheme for survivors. Eric Clark, Virgin Media News, Tuam, County Galway.
And the Taoiseach's apology to the residents of mother and baby homes, as well as nurses' calls for a declaration of a national emergency over COVID, will be among the issues debated on The Tonight Show here on Virgin Media 1 this evening at 10 p.m. Now, coming up next on the news at 5:30, the US House of Representatives expected to vote to impeach Donald Trump for the second time. And the Women's Six Nations and Under-20 Championships have been postponed.
As women, we deserve less. We deserve zero. Wait, what? I'm talking about periods.